Good morning, Mrs. Smith. How are you doing today?
I'm doing good. How about yourself?
I'm doing well, thank you. So I'm here to provide catheter care. Is right now a good time?
Yes.
Okay, let me provide some privacy, ma'am. Okay, I'm going to go ahead and lower the bed to the lowest position. Make sure I lock your wheels there. Okay, Mrs. Smith, I'm going to go ahead and lower the head of the bed, okay? All right, I'm going to take your call light for a moment. And ma'am, I'm also going to raise the side rail because I do need you on your side. Okay, Mrs. Smith, I'm going to go grab some water and I'll be right back. Temperature is good. Okay, Mrs. Smith, I went ahead and got you some water. Can you please test it to make sure it's okay?
Oh, it works. Thank you.
Okay, thank you, ma'am. We're going to go ahead and get started now. Mrs. Smith, I'm going to go ahead and expose you because I have to put you on your side so I can get that linen protector underneath. Okay, on the count of 3, we're going to go ahead and go to the side. 1, 2, 3. Okay, ma'am, we're all set. I need you to come back on 3. 1, 2, 3. Great. Thank you, Mrs. Smith. So for this procedure, I'm just going to expose from your hips down to your knees. Okay, when we perform this procedure, we have to be careful and we have to make sure we pinch the catheter at the meatus while we are wiping down. We're going to go 4 inches down. We want to make sure we go down in the same direction. We do not want to introduce any bacteria into the urethra. If bacteria goes in there, there's a possibility of the patient having a urinary tract infection. So we want to avoid that, okay? All right, it's time to begin. Okay, we're going to pinch the catheter at the meatus. And we're going to wipe down 4 inches. Flip the washcloth to a clean side. Wipe down 4 inches again. And let's go ahead and flip that washcloth one more time. Make sure we're still holding at the meatus and going down 4 inches. The washing part is done. Okay, now we're going to go ahead and rinse. Again, we're going to go ahead and hold as close as we can to the meatus, and we're going to go ahead and rinse down 4 inches. Flip your washcloth. And now we're going to go ahead and flip that washcloth one more time to a clean side. Remember, same direction all the time, going away from the urethra. Okay, the last washcloth is used for drying. Again, you must hold at the meatus, and you're going to go ahead and dry 4 inches down. Flip the washcloth to a clean side, and go ahead and flip that washcloth one more time, and we're going to make sure it's dry. Okay. All right, Mrs. Smith, we are all done with your catheter care. I'm going to go ahead and have you turn to the side so I can remove the linen protector. Okay, we're going to go to the side on 3. 1, 2, 3. And every time we remove a dirty linen protector, we're going to roll the dirty side in. Okay, Mrs. Smith, can you please come on back? 1, 2, 3. Thank you, ma'am. Okay, I'm going to go ahead and cover you up a little bit here. And let me go ahead and dump that water real quick. Step 1. Step 2. Step 3. I am now washing my hands. Okay, Mrs. Smith, I'm so glad we were able to take care of that for you. I'm going to go ahead and remove this side rail. I'm going to make sure that the bed is at the lowest position. And the brakes are on. Okay, ma'am, we're going to cover you up, make sure you're not cold. And would you like to sit up, Mrs. Smith?
Yes, please.
Okay. Is that okay?
Yes.
All right. Okay, Mrs. Smith, I'm going to go ahead and give you your call light. Please call me if you need anything, okay?
Okay.
Have a great day, ma'am.
You as well.
Thank you. I am now removing privacy. I am now washing my hands. Skill is complete.